Hi, I'm going to present on using restraints on a patient with dementia. So, in this case, a daughter say yes to restrain her father. However, this is not helping her father and worsen her father's condition. So, is using restraints on a patient with dementia helpful? First of all, why do nursing homes use restraints? Reasons for restraining dementia patients in nursing homes include fear of falls and protecting medical procedures, such as preventing patients from removing their gastrointestinal tracts. Using restriction has become popular in Hong Kong. According to the report, Hong Kong has approximately 1.45 million residents aged 65 or above, with 559,000 residing in various types of elder care homes, accounting for about 4.1% for relevant population. This proportion is steadily increased. Meanwhile, a local study following the situations for 10 years found that the proportions of elderly people in care homes subjected to physical restraints surged from 52.7% in 2005 to 70.2% in 2015. Now, in this case, we have these moral contradictions. The conflict between security and autonomy. Agree is prevent patients from falling, getting lost, or having their medical tubes removed. Disagree is providing the elderly of their freedom of movements and dignity. In balancing benefit and risk, short-term benefit is quickly prevents accidents and reduce caregiving stress. In long-term risk may lead to the physical decline, muscle hurt, anxiety, depressions. In real-world limitations, staff shortage, insufficient training, and environmental constraints. In ideal care, people-centered, requiring more time, patience, and creativity to care the elderly. In the family expectations, family may request to use restraints due to the safety concern, but in the professional judgment, the situation needs to communicate with the families to explain the risk of the restraint and alternative situations. This case primarily involves the following core medical ethics principles, such as autonomy, non-maleficence, and benevolence, justice. In autonomy, respecting the patient's right to make their own decisions. Non-maleficence is avoiding harms to the patients. Benevolence is proactively considering the patient's best interests and promoting their well-being. Justice is according resource fairly and handling conflicts of interest equable. The role in this case: first, patience, ethic analysis. From the patient perspective, his autonomy was completely stripped away. The restrictive behavior caused him both psychological and physical harm. He believed that the nurse's actions violated the principle of doing good because he didn't feel that it was for his own good. The influence of value, beliefs, and morality. Dignity, patience generations likely place good importance on faith and personal dignity. Being born in a severe trampling of the dignity. The fairness, they believe he did not do nothing wrong, yet was punished, which he seems as unfair. Freedom, freedom of action is an fundamental human need. Losing freedom is tantamount to losing the meaning of life. In the nurse's viewpoint, tethering him is the only way to prevent him from falling and getting injured. You may be facing a shortage of manpower and high work pressure. Your biggest worry is that patients might fall while getting up in the midnight middle of night, resulting in a hip fracture or even death. Driving by this fear, using restraint seems as the most direct and effective risk management tool. Your decision in primarily based on principle of non-maleficence, non-maleficence, but sacrifice the patient's autonomy in the influence of fear, value, belief, and ethics. Safety first belief. Your professional training and institutional culture emphasize zero accidents, which prioritize physical safety over emotional well-being. responsibility and guilt. If an elderly person has an accident while you are on duty, you will feel immense responsibility and guilt. This fear is powerful psychological motivation supporting the use of restraint. This case clearly illustrates a common dilemma in medical ethics. There is no absolutely correct answer, but through the role playing and the cost benefit analysis, we can clearly see that shifting from the old management-centered model to a new people-centered model, while more challenging, is more ethic and professional embody future direction. So this is the end of my presentation. Thank you.